Welcome to another episode of Health and Wellness. I'm your host, Kearni Warren, and today I'm speaking with Dr. Yudis, who is the Chief of the Department of Nephrology at Abington Hospital-Jefferson Health. We are talking about kidney cancer today. Dr. Yudis, thank you so much for taking time out to speak with us about this illness. Can you explain what kidney cancer is and just explain to our viewers what a nephrologist does?
Okay, so a nephrologist is mainly involved with diseases of the kidney and things that relate to this. And this is generally mostly medical diseases. So perhaps I ought to go over some of these areas first before we would get into the second part of your question. And so one thing is we're very concerned about the increasing incidence of kidney disease in the American population. There's roughly 73 million Americans who are at risk for kidney disease. So we're talking about like 1 in 3 roughly. And 26 million Americans actually have kidney disease. And the surprising and alarming part of that statistic is that of that 26 million Americans, most in fact, don't know it. So I think one of the jobs of the nephrologist and other medical personnel and educators is to try to learn who has these problems, to prevent them, and to work to that as our goal. The types of kidney ailments vary, and perhaps we can get into that as we go along.
Okay, now you talked about preventing the disease. Are there some behaviors that people could do that would make them less vulnerable to kidney disease, perhaps diet or lifestyle changes?
Well, perhaps I could answer that best by going over some of the causes, and then you could see things that might help lessen it or prevent it. One of the important causes is hypertension, high blood pressure. So from the kidney standpoint, we're very interested in hypertension, diagnosing it, finding it, then treating it properly, and preventing its bad complications which can occur, which can affect not only the kidney, but the heart and the brain and blood vessels in general throughout the body. So all these things are important. Another thing is the presence of diabetes. And diabetic population in this country is increasing. And this relates partially to increasing weights, obesity. And so it's a roundabout way of getting to your answer of how you can prevent this, because one of them is both to prevent and also to treat the people who have this problem. So one is to have a good diet. And a good diet is generally a diet that is somewhat lower in sodium, because sodium is one of the big factors in tending to add fuel to blood pressure. A lot of blood pressure is increased by the increased salt in the diet. If the patient or the person is overweight, weight reduction becomes important. Drinking enough fluids is important. All these things tend to add together. Stop smoking. Okay, smoking is definitely a risk for many forms of kidney disease, including kidney cancer. It's one of the risk factors for kidney cancer. So stopping smoking is very important. We always think of stopping smoking, well, that it helps the lungs and prevents coughs and lung cancer, but it also is important in terms of kidney problems. So this is important. Another thing is certain things we often use, we don't think that they'll elevate our blood pressure, but they can. For example, alcohol. Alcohol may be good in terms of the way it makes you feel, but moderation is really the word in terms of how much you should drink. And generally this is translated to about 1 to 2 drinks per day as a max, not more than that. And anybody who drinks more than that, particularly if they have anything related to kidney disease, they should decrease to that amount. So those are some of the things.
Okay, so we talked about what it is and some of the causes. Can we talk about some of the treatment options that are available to patients with kidney disease?
Sure. The thing with kidney disease is it's basically, we can think of it as 2 different types. One is what we call acute kidney failure or acute kidney injury, where there's an acute insult to the kidney that will cause a decrease in the kidney function and may even require dialysis, but it will usually get better if you can treat it properly. The patient will often improve so that they won't need dialysis. So what are the causes for acute kidney injury? There are many causes. Some of the important ones are drugs, medications. You know, we have so many drugs that are valuable and important, but many of these are bad for the kidneys. And for an example is many of the anti-inflammatory agents that are over the counter can potentially be bad if a patient already has a decrease in kidney function. And other agents can actually cause a problem in terms of the kidney. You know, we talk about allergies to drugs, but the kidney can share in those allergies. So if you have a particular medication that you're allergic to, it may have an effect on the kidney, even shutting down kidney function. Acute kidney injury can occur in the face of surgery, after surgery, particularly if you have some decrease in kidney function to begin with. So there's some underlying decrease in kidney function. But we hope in most of these cases they'll get better with proper care. They may require hospitalization, and it may actually, the discovery of acute kidney failure may actually occur in the hospital, sometimes related to things that they have. I mentioned that they might have major surgery, major infections, things of this sort, which will shut the kidneys down, and so we have to take care of that in this interim period until the kidneys can come back. Chronic kidney disease, what we call CKD, is a little different. CKD is a decrease in kidney function, which is usually less than 60% of normal, that is present for over 3 months. It may or may not be associated with a decrease in the amount of urine that's formed. So chronic kidney disease can lead to worsening function if it's not properly treated. And this is what often will cause the need for therapies such as dialysis.
Now let's speak about dialysis. What is that process and what happens when the patient has to take dialysis treatment?
Right. Dialysis is a process whereby the kidney cannot get rid of the normal waste products that are formed. And so to prevent the excessive rise in the body of these toxic products, they're toxic because we normally get rid of them, but if they rise to an abnormal amount, they become toxic and can give symptoms which we call uremia. So this is an important reason that you may need dialysis. But dialysis, the blood is taken out of the body in hemodialysis. This is the blood form of dialysis, where blood is taken out of the body through a catheter, or what we call a fistula, which is a connection between the artery and vein. And these will allow blood to go into a dialyzer. The dialyzer is in contact with a bath solution which does not contain any toxins. And the only thing that separates the bath solution from the blood in the dialyzer is a cellophane-like membrane. And the toxins will pass across this membrane, a process of diffusion. And this will allow these toxins to get removed from the body. The solution is discarded and new solutions added during the process of hemodialysis. So that's one form of dialysis. Another form utilizes our own body. That is, the peritoneal cavity, our abdominal cavity is used to do the same dialysis. And the way this is done is that fluid is placed into the abdominal cavity through a small tube, and the fluid is allowed to stay there for a short period of time, and then it's removed and discarded. And what happens is the fluid that's present in the abdominal cavity comes in contact with the surrounding blood vessels that are circulating through the covering of the abdominal cavity, the peritoneum. And that's the reason it's given the name of peritoneal dialysis, or PD, peritoneal dialysis. So it allows one to remove toxins from the body through this discarded fluid and achieve the same aims that you do with hemodialysis through the blood. So there's more than one way you can try to remove the toxins from the body. Okay.
What are some of the common symptoms a person may experience to alert them to visit a nephrologist?
Well, one important thing to know is there may be none. So you might say, well, why is he going to go to see the nephrologist? Well, one thing is to know your family history. Okay, so if you already know, wait a minute, somebody in the family has a kidney problem, or had a kidney problem, or was on dialysis, or both my mom and dad have high blood pressure. These are clues that maybe I ought to be checked too. So past history, your history, very important, your family history. These are all clues that kind of steer you into either discussing this with your primary family doctor or to the nephrologist. And usually the nephrologist sees patients that are referred by the primary doctor. So the first thing to do is to see your primary, your family physician, and then if that physician feels that, wait a minute, there's an issue here that I want to take care of that concerns the kidneys or potentially does, then the nephrologist becomes involved.
So are there any general symptoms a patient may experience?
Yes, they may have general symptoms. For example, if they actually have a form of kidney failure where the kidneys are not functioning and there's retention of toxic products, they may develop gradual weakness, fatigability, they get tired very easily, their blood count may go down, and they may have anemia, and you might say, why do they get this way? Well, one thing is that the kidney, we mentioned, is responsible for getting rid of many of the waste products of the body. But another thing it does is it has certain glandular function, endocrine functions. One of these is to produce a substance that stimulates the production of red blood cells. It's called erythropoietin. And this is actually produced by the kidney. It stimulates the bone marrow to produce the normal amount of red blood cells. So if the kidney is not functioning well, it reaches a point that the decrease in this erythropoietin will actually cause anemia. There's a decrease in the amount, the bone marrow kind of decreases its function regarding the red blood cell, and they get anemia, and anemia can cause weakness and tiredness, fatigability, and so this may be one of the symptoms.
So how is kidney disease diagnosed?
Okay, so kidney disease can be diagnosed by a history and physical examination and some simple laboratory studies. So I started with a history because it's important to know your history and your family's history, because if you have a history of kidney disease in the family, somebody's been on dialysis, somebody has high blood pressure, your mother has diabetes, these are things that might point to increased risk for you, and so they're all very important. And also certain diseases are more common in certain ethnic groups, so that's something to keep in mind. This can all be obtained just by the history. There's no laboratory studies, and so the history becomes very important. And another thing is the physical examination, which might show abnormalities in other areas that you were not aware of. For example, maybe they have some areas in the heart that are important. One of the things is in the laboratory studies that are routinely done, the studies are so comprehensive now that just with a simple blood test we can learn a lot about what is the kidney function, what is your level of products that are present in the blood. Are they normal at a certain normal level, or are they increased? If they're increased, this means that the kidney is not getting rid of them normally. So the higher the levels that you're getting in the blood may indicate decreased kidney function. And we can quantitate this quite easily by just looking at this through a certain formula that's used. So we can get a understanding of this. For example, one of the blood tests that is routinely done is to check your blood count, your hemoglobin, to see whether you have adequate amount of red blood cells. Because this ties into your possible symptoms. You may have, with kidney disease, you may have weakness, tiredness, fatigability, and this could relate to anemia or a decrease in your blood count. And the anemia related to decreased blood cells may be indirectly related to the kidney. So you might say, well, how does this occur? Well, the kidney produces, we mentioned that one of the main functions is to get rid of waste materials from the body, but another thing is to have a certain glandular function or endocrine function, where it produces certain hormones, one of which is something that will stimulate the bone marrow to produce red blood cells. It's called erythropoietin. If our kidney function decreases to a certain point, we're not producing enough of this substance, and the bone marrow decreases its production of red cells, and you develop anemia. And then you get weak and tired, and then you may go to your doctor and tell your doctor about this. So there are ways to treat this, because they're now available through modern techniques to give the erythropoietin or one of the analogs of erythropoietin to the patient. So this is something that is helpful.
And so what is a common prognosis for a patient with kidney disease?
Well, it depends on where they are in their kidney disease. As I think I mentioned, in chronic kidney disease, we talk about the definition as being below 60% of normal officially. We're interested even when it's a little decreased, but when it's below 60%, that becomes more important. And the prognosis really depends on where they are. If you're at 60%, that's fine. As you go down on the scale, it really is more important. For example, generally dialysis is not done until the kidney function is below 10% of normal. So that means the body can compensate through ways that you can be treated all the way down to 10%. So 90% of kidney function is gone by the time you need kidney support through dialysis.
Let's talk about kidney cancer. What is the difference between a urologist and a nephrologist in regards to kidney cancer?
Okay, so it's a good question because both areas deal with the kidney. And the urologist takes care of things in the kidney and in the urinary tract. But the urologist is primarily a surgeon, so that anything related to a surgical procedure or overt surgical maneuvers would be done by the urologist. The nephrologist deals with things that are primarily medical, and so that he deals with the diagnosis and the treatment, the medical treatment of many of these entities. And in fact, we work together. One area, for example, is a stone disease where kidney stones occur. So when the person has a kidney stone, that causes a lot of pain. And so they usually seek the attention of their physician, and they get to the urologist, or they may get to the emergency room first, where they get the diagnosis of their kidney stone, and the urologist will do certain maneuvers to try to allow that kidney stone to pass through the narrow ureter, which is present between the kidney and the bladder, this narrow tube that passes down there. And that's where the stone often gets blocked. It can't go through, because normally just fluid is going through there. It's not a solid material. But when you have a kidney stone, the stone is going through the ureter, it's blocking it, and that causes back pressure on the kidney, which will not only result in the pain, but will decrease kidney function. If it's bilateral, if it's both sides. We have two kidneys, fortunately, but you can get along with one kidney, as I mentioned, with transplantation. So in terms of the stone, the urologist plays a major role in taking care of the stone, trying to get rid of the stone. The nephrologist comes in terms of trying to prevent future stones. There are certain maneuvers that can be done to prevent any future stones. And anybody who's ever had a stone knows that you don't want to have another stone. So the nephrologist will look at the urine composition to find out what's in the urine. We used to refer to the urine from people who had kidney stones as evil urine, because it had something in it that caused them to have stones. We now know what these substances are. There are a number of substances that are present, that they're just present in larger than normal amounts. For example, if you have too much calcium in the urine or too much oxalate in the urine, the common form of kidney stone, calcium oxalate, is present, and this will cause the stone. And if you can do various medical maneuvers to decrease the amount of calcium and oxalate that you excrete in the urine. And this applies to other things. So that's one area of where the urologist and the nephrologist will work together in different aspects of the same disease, but trying to get to the right place.
Are there any other functioning of the kidneys that our viewers may not know?
There are. We only touched on a few, but one thing is in terms of the endocrine function, it produces or allows the release of certain hormones which are important in the regulation of blood pressure. And we mentioned that high blood pressure is so important to try to diagnose and to treat properly. So this is important in terms of the kidney's effect. And some people will say, well, where does the nephrologist come into high blood pressure? And this is one of the areas, because some of these substances that are released and acted on by the kidney are very important in the regulation of blood pressure. And if you have too much of one or not enough, it can have effects. Another area is vitamin D. The kidney is important in the production of the active form of vitamin D. Now, vitamin D, is important for bone health as well as other functions. And if the kidney does not produce enough of the active form of vitamin D, you can develop vitamin D deficiency and certain bone problems that can be seen. And this can lead to weakness, tiredness, and pain, actually, achiness, so that the bones can be important, and making this observation and treating it properly will prevent them from getting to the point where they may have adverse effects on bone.
So can you speak about kidney cancer and kidney transplants and how that relates in as the role of a nephrologist?
Okay, well, the kidney transplantation is an important modality in terms of treatment of chronic kidney disease. That is, dialysis is one way to treat it, but probably a better way to treat it is a kidney transplant. Then you're giving the kidney, a new kidney, to the patient. And the biggest problem there is lack of enough organs, not enough organs available. And we need more organs. And one of the things that people are asked when they get their driver's license, will you be an organ donor? And we wish that 100% of people would say yes, because this is where most of the organs will come, of course. Live donation is another way of giving a kidney. In other words, if the person needs a new kidney because of their end-stage renal disease, because of advanced kidney failure, they can get a kidney from a member of the family or even a friend. It doesn't have to be someone. There are people who are willing to give up their kidney, and this is a wonderful, really probably the ultimate gift that somebody can give to somebody else. And this is something that does happen, and it's happening actually more than it used to. Before a live donor, if I want to give a kidney, you're extensively evaluated to make sure that both of my kidneys are good. Because if I already have some decrease in kidney function, some kidney problems, then I would not be a good candidate to give a kidney to somebody else. So that there's a thorough evaluation by the transplant center to evaluate that potential donor. And the kidney transplant itself, of course, is a surgical procedure. The first successful kidney transplant took place 1954. So it really wasn't that long ago. I mean, it did midway through the last century, and this occurred in identical twins, and it worked out very nicely. But nowadays, kidney transplant can be performed in almost anyone. They have to be thoroughly evaluated. Their antigenic makeup is checked, so you get a kidney that will match. But this is the way to get a new kidney, to be off dialysis, and it turns out that it also is economically much less expense to have a kidney transplanted.
Let's go back to the kidney donors. Explain to our viewers who may have loved ones or friends or family who may be in need of a new kidney. Can a person continue to live an active life if he or she decides to donate a kidney?
Yeah, this is often a common question, and the answer is yes. There is. We only need one kidney. One kidney will suffice if it's a normal kidney. And so this is why the donor is so carefully evaluated, to make sure that the kidney that you're going to have, your only kidney after you give up the other kidney as a donor, has to be good. They both have to be good, but the one that's going to remain in you has to be, pristine. And so if it is, then yes, you can live with that one kidney. You have to be followed. You have to be checked by your doctor at least once or twice a year to make sure that the urine you're producing is normal, that your functions are normal, that everything remains good. But provided you're followed, the large majority of them, I'm talking about 90+%, of patients will do quite well, the donors.
Now, as a nephrologist, what are some of the common illnesses that you see in your practice on a daily basis?
Well, we see patients who are there because of their refractory hypertension. That is, they have high blood pressure that has not responded. And the referring doctor will want us to take a look to see if there's anything. There's so-called secondary causes of high blood pressure. That is, where there's an underlying cause. And if you can find out what that underlying cause is, you may be able to do certain things to treat it. For example, narrowing of the artery going to the kidney. So that, we will look for some of these secondary causes of high blood pressure. And generally, the higher the blood pressure, the larger the incidence of these secondary causes. Another thing is to try to get the patient on a regimen of medication that will work out for them. One of the big problems we have now in America is that we have a large number of medications, but are the patients getting them? And you say, well, gee, I gave you a prescription, but you say you're not taking it. So this is kind of the elephant in the room. That is the fact that the medication may be given, but there may be non-adherence to taking them. I don't feel like taking those medications. Why do I have to take so many pills? I'll cut it down myself. I feel okay. See, one of the things with high blood pressure is you may not know about it. You may not know how your pressure is unless you actually, do certain things and get it checked frequently. So this is important to not only to see the proper practitioner, but also to get the medications and make sure that these medications are good for you, because there are many choices now. So we're not stuck with one thing. You have to take only this. You say, well, I can't take this. This causes me some gastric distress. We can deal with other drugs. There's choices. So these are all things that the nephrologist becomes involved in, as well as looking into the kidney function and seeing what other studies might be needed, and along the course of their kidney failure, they may need other things like we related the active form of vitamin D, which they're not producing. We may have to give them that active form of vitamin D, or the erythropoietin to produce the red blood cells. These are all things that have to be done at certain times, and only through seeing the person can we do this.
What are some advancements that are being made here at Abington Hospital-Jefferson Health as it relates to kidney disease and kidney cancer?
We have this merger of Jefferson with Abington, and I think both institutions are benefiting from this. For example, we formally did not do renal transplantation at Abington. We would talk to the patient, send them down to the transplant center, and then they would evaluate the patient. But this involves another thing that may dissuade a patient. For example, they have to go downtown or somewhere else other than at the Abington area. We now have one of the transplant nephrologists come to the office and actually see the patients here who are interested in a transplant. In other words, to do this evaluation, do you need a transplant and what has to be done? And these things can be done right here so that the patient is not inconvenienced by going down to that transplant center, which is Jefferson.
How can our viewers, if needed, get in touch with the nephrology department here at Abington Hospital-Jefferson Health?
Through they could just call the hospital and get the phone numbers of the office and find out and make an appropriate appointment. So this would probably be the best thing.
Okay, well, thank you so much for taking time out
Thank
of your
you.
busy day to speak with us
Pleasure.
today on health and wellness.